It'll be interesting to see.
Good evening, good evening, good evening, good evening, Facebook friends and family, to all of our social media families, to Periscope, Instagram, Facebook, and each and every one of you. Thank you for joining us. What night is it tonight? Is Monday night, and it is time for Couch Conversations with the Doctors. Right here, no question is too big or small for our panel of great doctors. We've gotten all your questions. We get your emails, and we are here to provide information. Remember that this broadcast is for information purposes only, and that we are here to make sure that our constituents are well aware of what's available to them. A great resource for you. As always, we're going to go around the table and introduce each and every last person to you. I'm going to start. Hey, Karen. I see Karen is checking in. So, Karen, remind everyone to make sure that you check in, start your watch parties, and share this information because what health is wealth. I'm going to start with a great introduction of my very own co-worker. Doug, why don't you introduce yourself to everyone that's here?
Hi, good evening. I'm a retired physician. I've worked in the suburbs of Chicago for many years. Last year, I joined Representative Danny Davis in his office as a congressional fellow. I'll try and answer your questions if I can.
Wonderful, wonderful. To Sean Kennedy. Sean Kennedy says, good evening, everyone. Kathleen Jackson is here, and she's saying good evening to everyone. Yolanda Williams is saying good evening, all. Right over to the man who says that I'm threatening him to be here, but he knows that this is where he needs to be. That's our very own Dr. James Miller. Dr. Miller.
Good evening. Good evening, everyone. And, we're happy to be here tonight. Thanks to Congressman Davis for providing this forum. We're here to try to inform and to enlighten and to answer all those questions that you need to know about your health and how to make it better.
Wonderful. To the urologist of the stars, that's our very own Dr. Terry Mason.
That was my past profession.
Okay.
But I'm just grateful to be here with this very august panel of my colleagues. And I also learn a lot from them, as I'm sure you will tonight.
To the radiologist that can cure your fibroids, that's Dr. Reddy. Dr. Reddy, introduce yourself to everyone here.
Hello, everyone. Good evening. I'm Dr. Srini Reddy. I'm a vascular interventional radiologist, practice in Hinsdale, Illinois. I'm so grateful to be with Congressman Danny Davis and all the elite group of physicians from Chicagoland. And we are all here to answer any of your health needs, questions, concerns. Also, I'm here to learn from my colleagues too. Thank you again, Congressman, for arranging this event.
Wonderful, wonderful. To the doctor that family practice guru, that's really a weight loss guru, but he really has this passion to be on Iron Chef one day. That's our very own Dr. Tony Hampton.
Absolutely. Very excited to be here. My job is to help you think outside the box and not rely on conventional medicine as your only solution to being well. So I hope we can add value tonight, and I hope what we say will change your lives, hopefully.
Wonderful. And Yolanda Williams says, Dr. Reddy, are you from Amita Health?
I'm with part of Northwestern Medicine.
Okay, wonderful. To my co-host, guy who drinks coffee all day, just like the congressman, that's our very own Dr. Pete. Dr. Pete, that infectious disease specialist. Tell us about.
Hey guys, I'm the Director of Medical Support Services at Near North. Happy to be here and share with my esteemed colleagues. Thankful to you, Nikki, and to Congressman Davis for providing this forum. So I'm looking forward to this evening.
Wonderful. And to his alpha brother, who also drinks coffee all day, but he teaches us that health is wealth, the vanguard on healthcare. Our very own Congressman of the Illinois Congressional District, that's Congressman Danny Davis.
Well, let me thank everybody for being here. And let me say to all of our viewers that the same conversation that we have here on Monday evenings, this conversation is going on all over the world. And it's going on at the highest levels of decision making that exists in the world. If we were at a meeting of the World Health Organization and they were trying to arrive at some understanding, they'd be having the same conversation that we're having. Last week, I was privileged to meet with the Assistant Director of the Bureau of Primary Health Care for the United States Department of Health and Human Services, and with the Director of the President's group that is doing COVID. And the same conversation that we have is the same conversation they have. And the conversation can only be finding the best and most effective ways of trying to create the healthiest environment and the healthiest people that we can for the citizenry of the United States of America. And so you are indeed a part of democracy. Sometimes we have to talk about things that are unpleasant. For example, it's a very unpleasant situation related to the Loretta Hospital and some unfortunate decisions that they made. And of course, those have been headlines in all of the newspapers. But we hope that we're going to get that situation worked out satisfactorily. I participated in a meeting with the mayor's chief, I guess, one of her chief advisors, whatever the title may be, and Alderman Emma Mitz, who is chairman of the West Side Black elected officials a few minutes ago. And we said to them, no matter what the situation is, we want to make absolutely certain that the dosages of vaccine that would have been available to the residents of that community in the Austin area continue to be available. And they have assured us that that is indeed the case. And that even though that institution may not be distributing the vaccine at the moment, but the vaccine will just be shifted to some place else and for some other people to distribute. So, you know, we're very pleased that that is the solution, and whatever the other outcomes will be, will be. So I things are moving along. They really are. Any way you cut it, the environment is beginning to open up a little bit. Uh, Work is taking place. Uh, Actually, the Mass Center for Vaccinations at the United Center is moving ahead. And quite frankly, they are looking to hire people who can help do intake. And nothing much is required. They pay $17 an hour. So I'm sure there are a lot of young people who have not worked, people who just come out of high school, people who graduated from college, people don't have any work experiences, but I understand that they really are looking for about 200 people that they're going to be able to hire to do that. So there are job opportunities opening up not only in healthcare, but in other arenas as well. So, what could be better than having a job, having a bunch of health professionals trying to figure out how to keep you well, having food, because we increased the SNAP benefits by 14% for people who receive SNAP benefits, so you can get a little bit more. And if you cook it right and you get the right one and eat everything that's in the box, you probably do well. And if you don't know how to cook it, people like Nikki may be able to give you some advice on that. I don't attempt to give any advice on that at all. So I just eat it raw. And then I know I'm doing all right. But we look forward to a very interesting discussion. Thanks to everybody for participating. Thanks to everybody for being part of the chat with the doctors. Nikki, I guess we're really ready to roll. You mean I did all that conversation?
You're muted, Nikki.
And
No, I was muted. You were fine, Congressman. I was muted.
oh, okay.
Just as the Congressman shared that there are opportunities in some health laboratories, that link is on his Facebook page along with mine and a number of the other doctors here on the panel. They have actually uploaded that link so you can have that information. Just click right in and fill that link out and get your interview. So, with that being said, we're going to move right on. So, we got your questions and we're going to get right to them. We're going to talk about what is a fibroid and what is that cover on, cover off. That question that you sent in. Why do we put the cover on and the cover off? But we did have another question that was left that we had promised that we would get to, and that's the about Johnson and Johnson. So, Dr. Hampton, if you can grab that and we can start off with that, then we'll lead into the rest of the questions. That would be great.
Yeah, I think I'm glad that Congressman, I know we're going to deviate a little bit from the vaccine today and talk a lot about women's health a little bit, but I do want to, I was a little concerned about what happened in Detroit, and the mayor there made some comments about not wanting to, bring the Johnson & Johnson vaccine. And this is when it's very important that our leaders, and rather it's politics and spiritual leaders, to really lean towards the Faucis and doctors on this panel to get a little guidance before they make statements. And I think that he changed his tune a little bit. And the reason why I think he changed his tune is because when you think about, we hear the term efficacy of a vaccine. And many of us are aware that Pfizer and Moderna are pretty much at around 94, 95%. And then you hear about Johnson & Johnson at 66%. And I think anybody who's a consumer would want to get something that's at 90-something%. So I just wanted to clarify just for a moment why the efficacy is probably not where you should focus your attention. And just to understand what efficacy means, if I use Pfizer as an example, they had about 43,000 people in that study. And what they did is they have a placebo group, meaning they didn't get the actual vaccine, and you had the vaccine group. And what they found is that after they started the trial, about 170 of those 43,000 ended up getting COVID. And then the question becomes, which one of those people were placebo versus vaccine? And what they found is that the placebo group who got COVID were 162. And the vaccinated group was 8. So yes, you can get the vaccine and still get COVID, but that's where the math became 95%. If you look at 162 and 8 who actually didn't, had the vaccine and still got it, you got about 95% chance of not getting COVID if you got vaccinated. So that's where the efficacy. The question is, does that matter as much as we think? Particularly when you think about Johnson & Johnson being at 66%. And the answer is not so much, and I'll tell you why. The reality is you have to ask yourself, what are you actually trying to accomplish? And what I would want to accomplish when I was so fearful of this COVID, I didn't want to go to the hospital. I didn't want to die, and I didn't want to be on a ventilator, right? So the question is, when you think about Johnson & Johnson, Moderna, and Pfizer, how well did they do in that category? And I have good news. The good news is that they are 100% effective at preventing you from dying, going to the hospital, or having a ventilator. So if that's what your goal is, then you shouldn't care if it's Johnson & Johnson or Moderna or Pfizer. And by the way, it's not a fair comparison because guess what? The summer is when we did Pfizer and Moderna, and the incidence of the disease was pretty low. And then as the fall started to come in, all of a sudden, more people were getting it. And guess when? That's when Johnson & Johnson started their trials. And by the way, so they actually started it when we had more incidence of disease. They also started when the mutations started to kick in. They also did most of their trials in countries where the mutations were occurring. So they pretty much had a tougher battle, and yet they still had nobody hospitalized or on ventilators. So I wanted to say that out loud because a lot of my patients are coming in. I don't want that. I don't want that. The reality is you really do. You want to get the vaccine that's available to you because all of them are 100% effective at keeping you from getting severely ill from this virus. So I just wanted to start off the conversation with that because misinformation will, or how we interpret information will then cause harm to our families. Do not say no to Johnson & Johnson because, and by the way, it's only one shot, which is some of my patients want it because it's one shot and they're done. And that's a pretty, imagine if it's 2 shots and they're doing trials for that too. It's probably going to lift up its effective efficacy. So I just wanted to start with that, Nikki. Thanks for that opportunity.
No worries. Yolanda Williams says, thanks for explaining. And Wilbur Cook is saying, hey to everyone and to keep up the good work. And you guys are his favorite. So thank you, Wilbur Cook, for checking in with us. First question starts off with, doctors, I need your help. I am 49 and a half. And when I go to bed, it's either cover on or cover off. I have night sweats and my cycle is irregular. Just as well. I need help. My husband thinks I'm going crazy. That's the end of that question. So Jack Lynch says, good evening all. So is she going crazy? Is this a hormonal imbalance? Is there some things happening? Can you help her?
Well, I don't know. I'll just start off because I did have a lot of experience with taking care of women who have gone through that. But before I became really an internist, I'm a family doctor. I took care of a lot of women and children over at West Suburban Hospital in Oak Park and really missed those days. I miss delivering babies, Nikki. I love doing that. I used to love catching babies. Anyway,
bringing life.
Yes, right. So when you start getting into that 50-year-old range or so, a lot of times menopause will become part of your story. It doesn't have to be at 50. For some people, it's at 45. For other people, it's at 55. But we use 50 as kind of a expected age, and usually around about a couple of years before that, you go into what we call perimenopause. And when that happens, you're having issues around, making enough estrogen. The follicles that are stored in your ovaries are not making enough estrogen and hormones. So your body's kind of in disarray and trying to figure out what to do. And when that happens, and by the way, which is crazy, you probably have 1 million follicles, but you only use about 400 or so, which means a whole lot of them end up, dying off and degenerating. And every month, your hormones are making an effort to stimulate they're trying to stimulate your follicles. And then there's a winner. You get this winner, this dominant follicle that wins the war. And when that happens, the rest of them the ones that are being stimulated, some of them die off, and then you have the ones that are left. And as you get older and older and older, your ability to stimulate the leftover follicles gets diminished. And then those follicles then make estrogen and other things. So you can imagine how that can disrupt things. And that's why you go through a little bit of a perimenopausal phase, because as you start to lose follicles and they're older follicles and you're trying to stimulate them to then release an ovocyte, which is that'll eventually lead to a baby, all that function just starts to diminish. But ultimately, because of that decreased estrogen, you're going to have night sweats, you're going to have hot flashes, you're going to have, imagine trying to sleep and you're having all of those symptoms, right? And then as we get older, women struggle with vaginal dryness, and estrogen is important to protect the heart, and that's why we used back in the day we was really pushing taking estrogen for your heart, and it also protects your bones and it can affect your mood. So there's a lot of things that happen that's unfortunately physiologically normal, and fortunately there's some things we can do to help people. But ultimately, that's basically what this young lady is suffering from, and so the goal is to think about, what can you do? We shouldn't be as afraid of estrogen as we used to be, but we still have to be cautious. I think people are very nervous about estrogen. So when I deal with this personally in my clinic, I start with natural things. I start with things like black cohosh, which is more of an herbal way of dealing with this. And I think, so, a certain percentage of my patients will do well with black cohosh, and that's COHOSH. Some people will get creams like progesterone creams and other things. But to be honest with you, even how you eat matters. And me and Dr. Mason always go to diet. You really want to always stabilize. You don't want to have up and down sugars, up and down sugars. You want to stabilize your diet. And when you stabilize your diet, you'll probably feel better as well. You want to exercise. So a lot of this is general messages of wellness, but again, it's very difficult to deal with. But yet it usually takes, for most people, if they're lucky, they'll get through it in a year or two. But some people deal with it for years. And but what I found is that patients who do really well with wellness, they do much better, and because they stabilize their body, because your hormones have a lot to do with what you eat, right? So if you're eating a real whole foods diet that's balanced, you'll probably have less trouble. If you get enough sleep, you'll probably have if you can, of course. If you are keeping your stress down, you'll probably do better. So those are my initial thoughts, Nikki. And I think that that's why we speak a lot about you have to take care of that body. And a lot of these other things that occur will have a lesser impact on your body.
Okay.
Yeah, I would just like to add too. I agree with Dr. Hampton. I think when you have those temperature dysregulations, you have to do a thorough workup, and that workup might lead you down the road of other endocrine or hormonal problems like thyroid problems. You can have various, like he said, things that you eat, like caffeine, can cause you to have night sweats. Um, the the various like jalapenos, peppers, and things like that. So you have to be cautious about your stress, your sleep, your foods
Pepper.
that you eat.
Did you say jalapeno pepper?
Yeah, yeah.
It's a
So,
trigger.
so what I'm
It's a
saying is,
trigger.
yeah,
Trigger.
right, and you just have to go in, see the primary care doc, and give them the whole script. Don't just give them, because the idea is to always to lean more toward running down the failed reproductive organs road. But you can also have diabetes. You can also have thyroid problems and other things like that. You want to make sure that all those things get checked out as well.
Just add a couple of things. The lay terminology is change of life. And so these women are going through some changes in their life and the changes in their physiological system, in their hormonal system, in their bodies. And I think, and just like the question was phrased, am I going crazy? Because changes oftentimes make people feel strange because it's such a difference in terms of the way they were before. And adjusting to those behavior is also an important thing that has to occur, because um, you and your mate have to make adjustment, because again, they're not used to some of the changes that you're going to be displaying, and so it takes patience on their part to not get too upset when you get too cold or too hot, or not really sure about what you are, and begin to change everything. So these are changes in her life, and they're changes that are new to her. And again, as Dr. Pete said, we want to make certain that, number one, that it is just the hormonal changes that is taking place and nothing else. So, when you go to your primary care doctor and discuss these issues, they will, do some kind of evaluation to determine that, is there something else going on with you, or is this just the hormonal changes? Now, I said that, but also we got to recognize that this is a change in your life. There are other things that may be going on related to the change in your age and change in your and other endocrine glands in your bodies as well. And so, never just ignore and say, I'm just having hot flashes and I'm just going through changes of life, without really having it evaluated and discussing it. So don't take light of anything, but get it evaluated, so that you know, as best as you can know, that this is all that's going on, and that itself is a significant thing, because it has a significant change on your appearances and on those things that you sometimes care about. And so and your relationships, because they do affect many different things that go on in your body, in your life.
Dr. Miller, you make a good point. I think it's important to, I know Dr. Mason can attest to this, that men also experience something that we can label like menopause, when
Yeah.
when our hormonal levels are dropped. Okay, so
Mhm.
when our testosterone levels are not as high as they used to be, we don't feel as strong as we used to feel. Takes a little while to get the belly fat off. Takes a little. It's easier to get it on, and so I think it's important to recognize that both men and women experience changes, and we have to be patient with each other, and communicate those changes to your primary care provider, so they can help assess what's really going on. We can check men for their testosterone levels. There are various things that could cause drops in your testosterone. So I think it's important for both men and women, to your point, Dr.
Absolutely.
Miller, to check each other out.
Well, the menopause question was question number 4. So thank you so very much, Dr. Pete, for tackling that. As soon as you mentioned menopause, I have never seen the congressman give a side eye, but he side eyed because he was trying. He side eyed when you brought up menopause.
Oh yeah.
So, Dr. Hampton, you brought up a really good point when you said it could last a few years, could last a long time. So Kathleen Jackson asked, how long does this really go on? Can it happen past 60? And then we have another anonymous quote, another anonymous quote that says, apparently I must be really crazy because I'm still having this problem at 60. So does it go into the 60s?
It can. I won't go into too much detail. I'll let my colleagues contribute as well. But yes, it does for some people. But we have a bell-shaped curve, and when we look at a bell-shaped curve, right, there, 80%, are going to be, within a certain number of years, and it's not going to be all the way into the 60s and 70s. So, but then we have those folk who are outliers. I think the best way to judge it is to talk to those aunts and grandparents, if they're still around, who are female, and say, what happened with you? And then that'll give you a basic, because there are some genetics with that. But again, that's the reason why we talk about lifestyle, is because your environment affects you as well. So what exposures have you been exposed to that may have impacted your genetics so that you may react differently? And sometimes, I mean, there are plenty of things in our environment that act like estrogens. A lot of times they tell us to stay away from things like soy if you're worried about, because it mimics estrogen, right? So I think what it is you have to. It's almost like, as Dr. Pete was suggesting, you got to be a little bit of a detective and say, well, what is it that could potentially be causing me to deviate from the norm? And that requires a certain type of doc that thinks that way. And I'll be honest, like when you think about docs that think that way, they're functional medicine doctors. They tend to get to the root cause. So when you struggle and you have not been successful with your primary care doctor, you may want to, and they've done all the standard conventional labs, you may want to dive into a functional medicine doc who can also, help you find the root cause. But yeah, the short answer to the question is yes, you can definitely go into, I've had patients in the 70s, still have symptoms. So it's not that unusual at all.
I would just like to add to
Oh,
the conversation this notion of andropause, that is a loss of testosterone. And though testosterone is important for any number of things, as my colleagues have already brought out, most of the time, for most men, they will get that confused with a lack in firmness of the erection. And that's not really andropause. That's really a manifestation of a problem with the circulation. And that circulatory problem is related again to, as Dr. Hampton has indicated and others, it's really a dietary issue that we have to think about, because these particular specialized blood cells called endothelial cells that line all the blood vessels in all of our entire body can be damaged. Much of that, and I'm not going to go into a lot of it right now, but it can be damaged. And these things are responsible for feeding blood to some of these vital organs. And if they're not able to feed the blood in the supply at the pressure that it's supposed to, then you might see, particularly in men, an erection that's not as hard or can't maintain as long. And we have to remember too that women also have an erection. The clitoris is involved in sexual satisfaction for women as well, and the clitoris is really, in many ways, very similar to the penis. And when men are having, and as women get older, they may have issues along with clitoral engorgement that also is important for their sexual satisfaction. So we just need to make sure that we looked at a lot of these things in a way that gives us a far more holistic approach to how we treat them.
all right. So Yolanda Williams says, Dr. Mason already got me changing my diet. Now, Dr. Hampton, too, I really appreciate this panel. Treat the whole body and the mind. The whole body and the mind. Yolanda Garrison is checking in. Yolanda Williams says, wow. And Edna Weatherspoon says, watching with you all. What is a prolactin level?
Anybody? It's a blood level for looking for a particular hormone.
Oh,
Yeah. It's
so that's what it is. It's just a blood test that measures prolactin. And prolactin is a hormone that's involved in a number of things. What is the context that they're asking the question in?
that was all they wrote in the question.
Okay, be nice to know what else.
What is a prolactin level?
Yeah. So prolactin, to Dr. Mason's point, is one of the hormones that is responsible for lactation for women who have babies. And so usually you'll detect higher levels of prolactin when women have had their baby and it's time for them to produce milk for the baby. When those levels are too high, when in the absence of a pregnancy, that's when it's time to think about some hormonal problems or problems with your hypothalamus or your pituitary gland, where it's producing more hormone than it needs to in the absence of pregnancy. So that may be where they were going with that, Dr. Mason.
So to add a little bit about the prolactin, if the prolactin levels are high, that could cause in women some kind of menstrual problems and also sometimes infertility too. And in the men, sometimes it could lead to decreased sexual drive and also some kind of erectile dysfunction too. So prolactin has a in addition to the lactation, but it does affect emotionally in both men and women too.
All right, great. What is a fibroid exactly?
So fibroid is a benign, it's a non-cancerous benign tumor that arises from the uterus smooth muscle. So it comes from the uterus wall. These are benign tumors. that we could see in women. It could occur anywhere from 18 to up to 50, up to they reach the menopause. So, and a lot of these people, it's more prevalent in African American women, but any ethnic women could have it. But many majority of these patients don't have any symptoms, and when they do have symptoms, they do have a lot of other symptoms such as like heavy menstrual periods, frequent urination. Sometimes it's very difficult for them to empty the bladder, painful intercourse, and a lot of other symptoms would come with it.
So the next question is from a gentleman who says, my wife was diagnosed with 7D fibroids. She is also pregnant, telling us to be very careful because these 7D fibroids could grow along with the fetus. Is this correct?
Definitely, fibroids are hormonal related. So during pregnancy, there's going to be a lot of hormonal impact during the pregnancy. That's why there is one concern: if patients with the fibroids, they could have miscarriages and stuff like that, because a lot of these fibroids occupy majority of the uterus, and it's very hard for the baby to grow. And we see tens and twenties of fibroids. Some could be small, some could be big. It's very, there is it's, even though it's very common, a lot of the physicians, and we don't know exactly why we get it. What is the reason? Some are small, some are big, some are symptomatic, some are not symptomatic. To answer the question, definitely, the fibroids, the larger they do get during the pregnancy, and that could cause a lot of issues with the pregnancy.
The next question says, Congressman Davis, thank you. A few years back, you did a series on this back in November over at Christ the King. This was really informational to the constituents in our district. I was there for all three sessions, but I did forget what was the treatment for fibroids. Can one of the doctors share the list of treatments for fibroids without having a hysterectomy? I am 34 and I don't want a hysterectomy to be my only option.
So that's an interesting question. So there are various treatment options for fibroids. There is a 1 in 5 women who have the fibroids don't really know the various options that exist there. So to start off, there is a medical management. You could give birth control pills or hormones to control the symptoms of fibroids. Then comes surgical management, such as hysterectomy, where you surgically remove the uterus, and something called a myomectomy, where you go surgically remove the fibroids, just fibroids itself. These are all invasive procedures, involve some risk. There comes a non-invasive or minimally invasive, a procedure called uterine fibroid embolization. The word embolization is simply cutting off the blood supply to the fibroid. So you thread a catheter into the blood vessel that supplies the uterus and block the small blood vessels that supply the fibroids. Fibroids have a lot of blood supply. So wherever there is a fibroid, there is countless number of small blood vessels there. So by placing a small, tiny particles, they go and block the blood flow at the fibroid level. So we are basically starving the fibroids of nutrients, and then eventually the fibroids die and shrink. So that's one of the treatment. It's a great alternative treatment for hysterectomy or myomectomy. It's safe in terms of safety and efficacy. It's being done as an outpatient. You come in the morning and you could go home the same day. It has increased quality of life comparing to the surgical options. Obviously, hysterectomy is the definitive treatment, and a lot of the studies do say for the symptomatic relief, uterine fibroid embolization is as effective as hysterectomy. I like my colleagues add a little bit more.
I only want to add that this reminds me of when I did a podcast with Rashard Johnson. We talked about systemic racism and we talked about a Mississippi appendectomy, which is when they take the uterus out without permission back in the day, right? And I bring it up to say with knowledge comes power. And so, for all those ladies listening who are then faced with decisions about what's the best option, now that you've heard this term from Dr. Reddy that gives you another option, is uterine embolization procedure. Now you can go to your clinician and say, I want to hear more about that. I want to learn. So, you want to know what your options are so that when you're faced with choices, the only option won't just be a hysterectomy. You should know about a myomectomy, which is taking a part of the uterus versus it, because you may still want to conceive. And a lot of times in communities of color, we don't have options. We just are told we can only do one thing. And you would think that would exist in 2021, but the reality is it does exist. So the more knowledge you have, the more ability you'll have to have an intelligent discussion with your clinician who may not be thinking about that himself or herself, but it's important that you think about it so that you can make the best decision.
Since we're talking a great deal, no, go ahead, Dr. Mason, then I'll ask the question.
The only thing I wanted to say, Congressman, is that what women need to understand is that your entire uterus is a muscle, and its function is for childbirth. That's what its function is there for. Now, why am I saying this? Because these things we're calling fibroids, they're really benign muscle tumors. That's what they really are. And what happens is sometimes, and I have, as being a urologist, I was oftentimes called into surgery with some of my gynecologic and or general surgery colleagues. Sometimes these things can grow to enormous sizes. And at county, we used to have, particularly before the ACA, a lot of women would be bleeding down. Let's say your blood count should be, one of the numbers should be somewhere around 13 to 15. Some of them would come in with a number around 6 and needing lots of blood to be transfused because they bled so much. But the point is that these muscles, this additional muscle that grows, the number of things that we believe that help stimulate it, and I won't get into all of the dietary things right now, but it's important to understand that the first thing you need is to be seen by a gynecologist. Yes. or a family doctor that can at least get you an ultrasound, which is a sound wave test to sort of see how big it is, where it is it inside or outside? And I can tell you, I've assisted on surgery where we taken out fibroids this big, literally this big. And it took two of us to just hold up this thing because there's a lot of blood vessels that feed it. And so it takes a lot of work to make sure we get it out safely. So an ultrasound, if you're having any of these things, and I'm sure most of your gynecologists will do an ultrasound, but it's a non-invasive way, and Dr. Reddy may comment more, but it's probably the easiest non-invasive way. It doesn't hurt you or anything, and it could tell you a lot about the status of your fibroids or your myomas, uterine myomas, as we call them.
I agree with you, Dr. Mason. So several times I was called by a gynecologist, huge, when they were trying to take big fibroids. They asked me to embolize the uterus so there would be decreased blood loss during the surgery. I had done it several times. As you said, ultrasound is the best screening study, quick. We could tell where the fibroid, how big is the fibroid, and then speaking to your family medicine physician and gynecologist and listening to the options that are out there. A lot of the time, if you go in that route of uterine fibroid embolization, the interventional radiologist may get an MRI to understand the exact anatomy when we actually do the procedure or to find the blood vessel, and then we would know how to do it. So majority of the time, ultrasound is the best study to start off, which is very quick, non-invasive, no radiation, no X-ray, nothing.
Since this is
Congressman?
since this is Women's History Month, and we are talking about illnesses and diseases that affect women in a real way, my question is, what is lupus, and why does there seem to be great discrepancy between the expectation of African American women getting lupus and white women getting lupus?
You know,
Dr.
that's
Doug, you want to take that
yes.
one, the
I'll,
rheumatologist of the group?
I'll take that one. You know, it's a disease that is still a mysterious disease. And all I can say is it's been really impressive in the last decade to see the way that the research on this illness is evolving. It's a disease where the body starts attacking itself and makes the mistake of the self being like something foreign. I'm not sure that it has something to do with skin color, because clearly sunlight causes damage that can trigger this reaction. It doesn't quite make that much sense to me. I can also tell you that some of the diseases, lupus has so many different variations that a disease in a black woman may not be the same as a disease in a white woman, yet it's still the same disease. I don't think I can carry much further than that. I mean, it is a very, very challenging set of circumstances. I also think it's really related to hormonal changes as well. You know, we start seeing the incidence of this disease begin to start in the 30s, the 40s, and 50s, and there's a second incidence of the disease in the 60s and the 70s. But
Yeah,
there's
I think
a tremendous amount of international research that's taking place that didn't take place before the internet. It's a very, very well-knit community.
Yeah.
I will
What's
also,
treat?
I'm sorry, go
Yeah,
ahead,
no, I
Congressman.
was going to add to what Dr. Doug said, in that it is a disorder where the body attacks itself. Your immune system attacks itself. It's difficult to diagnose in many cases because it takes the form in different organs. So you might not have the same presentation in every single person. Somebody might have a skin rash, the other person might have loss of hair, the other person might have some kidney dysfunction. And so what happens is it really does take um, one provider that's able to put all these symptoms together and say, hey, you know what? We might need to check some blood levels to see if you have lupus, because of all these different types of system changes and destruction of that particular organ. And so that's what makes it so difficult. And then in terms of treatment, you're giving people medicines that sort of destroy or slow down your immune system, which of course then puts you at risk for other like infections and things like that. So people are put on prednisone, they're put on immune modulating drugs, and those drugs lower your immune system, which then puts you at risk for getting infections.
Yeah. I just want to add one little thing. I agree with what Dr. Pete is saying in terms of how this disease doesn't always present itself in the same way in every individual. And I recalled a case that I had of a woman in her 30s who presented with complaints of chest pain. And in the hospital, most of the time, we always begin to do a series of studies to rule out MI rule out a heart attack when people present with chest pain. And this individual, the enzymes were all consistent with her having an MI. And so, she went through the whole process of having studies for her heart to see if there was blockage. And sure enough, it came back that her coronary artery was perfectly normal. However, at that time, we did not know that this young lady had lupus. And as we began to evaluate her and in terms of other causes for MI and vasculitis, that eventually turned up to be the cause why this young lady presented with a heart attack as a presentation and manifestation of her lupus. So this can be some. I've seen patients where it turns up that they come in not because they're having a lot of the classical musculoskeletal problems, but having strokes and other kinds of issues or ischemic issues in their limbs. So this can present as a many different ways, and so lupus is a very serious problem, and one has to be aggressive in their thought process when people sometimes present with conditions that doesn't really fit the usual mold.
So research is very important as it relates to this particular disease, and I guess that's why I pride myself on being one of the most research oriented members of the Illinois delegation, in that I support research, a lot of money for research, because I think as long as we don't know things, we need to be trying to find them out. So thank you very much for that.
Congressman, I just wanted to add one other. Oh, I'm sorry, Dr. Maya. I just wanted to add one thing to what was being said. These diseases, these autoimmune diseases, are inflammatory diseases for the most part. And as Dr. Miller already indicated, the inflammation can be quite damaging, depending on what the kidney or whatever organ gets involved. I would raise, and I'm sure Dr. Hampton has seen and heard some of this stuff, and I appreciate what you said about research, but there are some parameters around research that make some of this a little more difficult to do than other things. Because unfortunately, the way our research is set up, you have to find that one particular thing that you can identify, isolate, and say that particular thing did it. And that may be fine for some things, but there's some things where it's not a solo, but a symphony. And so there are a number of factors that add together. And so I was lucky enough to be at a meeting with a bunch of physicians, and there was a lady by the name of Dr. Galdiner. Dr. Galdiner is a neurologist, and she was diagnosed with lupus. And they told her she'd never be able to have children, she wouldn't be able to do this, wouldn't be able to do that. And so Dr. Galdiner, and again, I'm just giving, and you can get her book, it's called Bye Bye Lupus or Goodbye Lupus. And what she did was she put herself on a strict, uncooked, whole plant-based diet. And it did more for her than all the medications that she was being given to by her rheumatology disease people at a very prominent hospital on the East Coast. And so I say that because she also began to coach people like some of our very famous tennis players that had things like Sjögren's syndrome and some of these other inflammatory diseases. So the one thing that this all proves, and when we did, as I talked about before, when we did that for 5 weeks at Trinity, putting people on these kinds of diets, we saw all of their inflammatory markers decrease tremendously. Like the TMAO dropped by 43%. A lot of the low density lipoproteins, a lot of these things change with that. So I just say that because it is an environment that a lot of times, in order to treat our diseases, we have to change our internal biochemistry. And unfortunately, because of what we eat, our internal biochemistry is often toxic. And this is what creates environments for these diseases. Dr. Maya, I just wanted to make that point.
No, thank you so much, Dr. Mason. Nikki, thank you for letting me join late. I was still at work, just got out of clinic. I did kind of on the back end try to listen, and I love the great conversation. If I may, just a couple of things. Originally, I love that we talked about thyroid and menopause and things like that. The average time for menopause is about it's going to be it can last 5 to 8 years, like from, start to finish. 5 to 8 years is what they say it is. And then the average woman goes through menopause at age 51 in the US. That is because of the hormones and the things we eat and things like that. Yes. But there are different causes of of menopause. It can, it can be just decreased cycles, which is what happens that Dr. Hampton explained. Surgeries, chemo, and radiation can also cause menopause, and then ovaries can fail for lots of different reasons. But all leading to kind of what do we look at on the other end of menopause, which is an increased risk of the number one killer of women in America, heart disease, at the end of menopause. That's why diet and activity is so important. Not, I mean, yes, it is. Anytime you start is great, but having your heart and your body trained to go through these things. So the earlier you start, don't wait till you start going through menopause, but the earlier you start making those changes can strengthen your heart. Osteoporosis, sexual dysfunction that I believe Dr. Mason, you talked about due to vaginal dryness and just changes in weight. And then on the other end of it, we were just talking about lupus. Um, I think someone asked about the difference in ethnicity. Well, on top of that, the congressman mentioned research. Research shows, like they were like, why is it so hard to diagnose? Number one, because it's like 11 criteria. And anytime you see 11 criteria, that means we in the medical industry are having a hard time pinning down exactly what's going on. So it's 11 criteria to diagnose lupus, right? And then imagine 11 criteria on top of something the congressman mentioned research. Research shows that when a woman of African descent or Latin descent presents with now inflammation, pain in my joints, pain in my heart, pain in, pain of anything. Look what happened to some of the people, Serena Williams, we'll throw that out there. When they went into the hospital in pain, research shows that the medical industry believes
Yeah.
they're painless. Yes, you're saying you're in pain, but I think you're not. And so that's why it's so hard because if there's 11 criteria, and then a lot of times women of color, when we present, our criteria isn't weighed the same, or what we're saying isn't weighed the same. Our history when we tell you're in pain. And so that's why this discrepancy kind of is happening with lupus. And then, watching your inflammatory process or how you set your body up to deal with the changes through life, whether that's autoimmune or whether it's just hormonal, I think is important. So intake, I'm learning to come away from saying diet. Nutritional intake and activity is very important in all of these things, including the one I didn't touch on, which is fibroids, that Dr. Reddy touched on, which is fibroids. There's a string of things here, just activity and nutritional intake early in the game can prepare you to deal with different stages of wellness, right? No matter what that is. So thank you for letting me
It's
join.
amazing how things kind of stimulate. Someone mentioned Serena Williams. I just picked up Katrina Adams' book. Katrina Adams grew up right down the street from here and became one of the top 10 women tennis players in the world. And I just picked up her book. She had a book signing out at the tennis court on 53rd Street on Saturday. And it's just amazing. And also, we're doing our Women's History Month celebration on Sunday, where we're going to highlight a number of very outstanding women who lived and grew up in the neighborhood where we are. So if anybody's interested in, tuning into that, they can just call my office and they can give you the link and you can tune in. But there are so many exciting things going on. I don't know how anybody could ever be bored
No.
in America.
Wow, you're right. You're absolutely right, Congressman. You guys are going to hate to hear me say this, and I'm to our audience, but this is going to be our last question of the evening because we have reached this time. So, we have a question here that says, Dr. Pete and Dr. Mason, thank you for shedding light on lupus and how it shows itself in many forms. My question is, can lupus form itself as tumors in the uterus and or rectum? Can it show up that way? My sister has been to the hospital on several occasions with several different issues, and now they're saying that it may be lupus.
Yeah, typically those are not your classic presentations that happen with lupus. Classically, people will have problems with their skin rash around the face. We call that discoid lupus. They will have their hair will start to thin. They can have some heart problems. So again, it's the body, the immune system that attacks its own self. So the problem is the body attacks itself, and it can and usually targets certain organs and joints. So the classic presentation is more of arthritic complaints, and typically the arthritic complaints happens on both sides equally, as opposed to osteoarthritis or degenerative joint disease, where it happens in your weight bearing joints and usually one side or the other, or it happens more on one side or the other. So though that is not the typical presentation that will happen. And usually, again, it's like Dr. Maya said, it's those 11 criteria, which I forget exactly what those are, but it's it's a multitude of symptoms that you'll have, and it really takes somebody to put all those symptoms together. Don't and then not to mention those symptoms don't happen at the exact same time. So you might have your hair thinning 3 months ago, and all of a sudden you come in for your visit, and your kidney function is off. Then 3 months later, you start having chest pain, so that's how it typically presents.
So recently, I had a young lady came in her 20s about a month ago. Came in with the leg pain. She had a lupus. I had extensive clots in the veins, where I had
Mm-hmm.
to put some medication into the veins to dissolve the clot. So the blood clots is one of the things that we need to look for lupus too.
Okay, well, I we do have one small additional question, and it's a COVID question. And that question is, please explain why the second COVID vaccine sometimes produces various side effects like fever, body aches, etc., that the first shot did not do.
So one way of looking at that is it's your body responding to the vaccine.
Exactly.
And the first one prepared you, and the second one says, "Let's get going."
Let's get going.
That's actually
That's good.
Mm-hmm.
so that's actually a healthy thing, not an unhealthy thing. It shows that your body's responding and it's going to be prepared.
Wonderful. Wonderful. Maya, you have to say something?
I remember growing up when two things they say. You ever heard of that saying? They say, "I'm gonna kick butt and I'm gonna take names," right? And so that first shot, your body, your autoimmune or your body soldiers go in, they kick a little butt, but they take that name. Now, what's the purpose of taking that name? Because when you come back around on site, I'm going to get it. So that's exactly what happens. You get that second shot, and your immune system like, oh, you going to try me on site. Now they got their cousins, they got everybody. What you want to
go. There you go.
You get it, Maya. All right. All right, Maya.
All right.
Goes to war, it says, guess what? I'm gonna try to smoke you out. I'm gonna raise the body. I'm gonna raise my body's temperature. So there's some chemicals. They're called ketokines, but that's interleukins and stuff like that. But anyway, they release and they raise your body's blood temperature. Anytime your body, raise your body's raise your body's temperature. Anytime your body temperature is up, you're gonna feel a little weird. You're gonna feel a little, something. But that's just really your immune system saying, bet on site, let's do it.
Thank you, Maya. That's good because I'm getting my second shot tomorrow.
Okay. I like it. Smoke it out. So Linda Johnson says, hello, Dr. Maya. I see a lot of the members of Pastor Matthew Miller's church are leaning over saying hi to Maya and Dr. Miller. You sure you ain't joined over there? Maya, you sure you ain't did that in some
Dr. Miller got me out here. Yeah. Dr. Miller got me out here. Yep. And I do want to say, Nikki, also is because of a lot of the connections that I always talk about two people. Miss Pauline Montgomery, who is a person, you know, a lot of people don't know her, don't see her. She doesn't, I mean, if you see her, you don't know her, you know, but she does a lot of work in the community and makes a lot of collaborations. And then Nikki, you make a lot of collaborations, and then you sit on the comment like, hey, you know. And so I remember the first time I met Dr. Miller, I was like, testing. We're going to test. He said, great. How about that vaccine? What you going to do? You know, so thank you, Dr. Miller, for making a lot of things possible.
Okay. My pleasure.
The Millers will get you, girl. The Millers will get you. You know, Kathleen Johnson says, great. And Linda Johnson says, I just love the way these doctors compliment each other and thank you. Yolanda Williams says, they are awesome. Are simply awesome. Winona Redmond says, thanks for all of the important conversation. Yolanda Williams says, diet. I got to work to change my life of the food. Kathleen Jackson says, Dr. Hampton mentioned black cohosh. Is there a certain length of time that it should be taken?
Yeah.
Sean Kennedy says, hashtag Dr. Maya, and so on and so on. Thank you to the doctors for their information and the information that they share. Virginia Knight says, we are alive. Yolanda says, we love this panel. You guys are going to be blessed for taking for us. Kathleen Jackson once again adds, this was a tremendous conversation tonight. And it's March Madness, but it's also Women's History Month. And that's why we wanted to make sure that we shedded some light on women's history. But health is wealth. As we always do, we're going to go around this panel once again and we're just going to ask, what's your until next Monday? I'm going to start with Dr. Reddy. Dr. Reddy, if there was something you wanted to share with all of the viewers on tonight, what would you tell them to hold them over until next Monday?
You know, I still like to reiterate, like everybody else, the vaccine. You know, to combat this COVID-19, we got to get the vaccine. Everybody, it's not Pfizer, it's not Moderna, it's not Johnson and Johnson. All these vaccines, we need to think about, as Dr. Hampton said, we got to, you know, these vaccines have proven to decrease the severity of the disease, decrease the hospitalization. That's why it's not what vaccine, but all vaccines are the same. So we got to make sure that every one of us should get the vaccine as soon as it is available.
Wonderful. Dr. Douglas Graham, until next Monday.
You know, I just want to say the same thing Dr. Reddy said and Dr. Hampton. And the biggest reason is not to try and select it is the quicker you get vaccinated, the quicker you keep it from mutating. And that means we don't have to have a booster shot next. So if we try and get the best one, we may give that virus a window of opportunity that we would want to give it. So everyone's got to get it as quickly as they can.
All right. Dr. James Miller, your until next.
Until next Monday, as we're discussing about healthcare issues and what we need to do individually and as a community, let's keep that going. I mean, let's keep thinking about that as a community. What it is that, how do I need to change? We hear a lot about all the bad stuff that are going on and the problem with healthcare disparity and the history of how certain people, especially people of color, have a healthcare deficit in terms of supply. So let us think about what we can do individually to help to be certain that we can be as healthy as we can. In terms of, there are things that we can do. We can eat the right thing. We can exercise. We can make certain that we are going to see physicians so that we are getting the proper evaluation. So pay attention to your health. That would be my until next Monday.
Great. Dr. Maya. Dr. Maya Green, your until next Monday.
Until next Monday, even more so. I remember when there was a point where someone mentioned like coming this far, I just even more what I'm seeing in the news, what I'm seeing, this is not the time to turn back, to break down, to do that kind of thing. We can move forward as a human race with equity, put some equity into action, take your shot, clean your hands, put your mask on, protect your tribe. Don't give up now. We see a light at the end of the tunnel. Come on, y'all, let's do it together.
I remember that statement. That was you and Dr. Mason, and then you summed by faith. All right. Dr. Tony Hanson, you're until next Monday.
I'll basically just answer Kathleen Jackson's question about black cohosh. And I think whenever you're taking herbs, you want to, of course, listen to your body. And if you take anything, rather it's a medicine or herb, you take it. And if it's not working within an expected amount of time, I think a herb like black cohosh, you want to give it about, 6 to 8 weeks. If you don't see the benefit, then stop taking it. That's the first thing. If you would look at the standard organizations like the College of Gynecology, for example, they probably tell you to take it for 6 months and then circle back around with your physician and touch base. If you look at functional medicine docs, they tend to be a little bit more aggressive. So if you're being successful with black cohosh as a herb and you're not having side effects and your doctor is aware, you could probably take it for quite a while if it's working. So I think it's individualized and it's based on how you respond to treatment. So that's until next time.
So, Dr. Hampton, does it act as an anti-inflammatory?
Absolutely. In fact, that's the beauty of using nature, is that most of these herbs absolutely do that. I don't think it really has an increased estrogen effect, if I recall. I think it's more of an anti-inflammatory effect. And that's why, going back to those other points we made earlier, a lot of the things that help us are about, we say inflammation almost every time we have a conversation. So if we can work on inflammation as part of how we treat the human body, a lot of the things that we suffer from will fade away.
Yeah. All right, wonderful, wonderful. Dr. Terry Mason, you're until next Monday.
Your health is your most important asset. You can guard it by using three things. You need good physical food, good spiritual food, and good mental food. You need it balanced in just that way.
All right, Dr. Pete, you're until next Monday.
Yeah, just to echo what my colleague said, I view health and medicine through a social justice lens, and we are committed to advocating for our patients. And one of the best ways we can do that is by listening to you. And if you don't have a provider that listens to you, you got to get another one, because, so many times, to Dr. Maya's point, women will come in and complain about something, but because we're tainted with society's lens of who this person is, that we don't listen to our patients. And so I just want to advocate for our patients: one, to pay attention to your body; two, advocate for yourself and speak up; and then three, to Dr. Mason's point, you've got to pay attention to your spiritual and physical and mental body. So for me, figure out something to laugh about every single day. If you got to cut on a Cat Williams video or a Bernie Mac video, do something to laugh, because I believe there's medicine, there's good hormones that get released, and endorphins, and gets released when you laugh. So just laugh about something once a day.
All right, all right. And Congressman Davis, you're until next Monday.
Well, I guess since this is Women's History Month, I just mentioned Dr. Agnes Latimer, outstanding female physician that I had an opportunity to work with, and also a good doctor who really kind of opened up the American Medical Association, especially to African Americans and to women. And I'm thinking of the first political fundraiser I ever went to. It was for a guy named um, George Collins when he was running for Congress. And of course, he was the first black congressman for this area. Then his wife followed him, and I followed her. And George was making a speech. He said, "The politician Confucius says that he who tooteth not his own hand will find that same will not be tooted." And I was thinking of how fortunate it is to be a member of Congress, where we just passed the most important piece of legislation that I've ever worked on and ever been an integral part of, and that has probably happened for more than 50 years in this country. Something called the Rescue Act. I sit on the Ways and Means Committee, and 941 billion of that $1.9 trillion was marked up in our committee. I also sit on the Committee on Government Reform, and $350 billion of that money was marked up in that committee. And so I had an opportunity to be a part. And much of that 941 billion really came through the subcommittee that I chair that has jurisdiction over unemployment compensation, jurisdiction over child welfare issues, and to think of all the millions of people who've either gotten the $1,400 check already or will be getting a $1,400 check if their annual income is $75,000 or less, or the billions of dollars that hospitals and community health centers will be getting to give the vaccination, billions of dollars, more money than I even knew how to count. That's just simply to be there and be a part of making that kind of decision that's going to impact in a very positive way the lives of practically all the people in this country. And to know that 2/3 of that money is going to touch directly the lowest income and poorest people and people of greatest need in this country. I went to a funeral Saturday, and funerals are never, supposed to be great things, but it's something that we will all have at some point in time, one way or the other. And this lady who had died, her name is Rose Monk. She was 97. She would be 98 next month if she was still alive. But Miss Mangrum one year registered 3,000 people to vote. She was not of loud, boisterous. She just did what she did. And I used to give her a ride a lot of nights home when we would finish meetings and that kind of thing. And you wouldn't have thought that she had the kind of impact on her family. She was from Shaw, Mississippi, and migrated from Shaw, Mississippi. And her family had a whole bunch of doctors and lawyers and other people. And they all had come from Shaw, Mississippi, because when she got here, she would send for other folks to come and provide an opportunity. And it just reminded me that Lou Palmer used to always say that when you went through the front door, don't go alone. Reach back and bring somebody else with you and drag somebody else in. And so she did a lot of reaching back, and her family was so appreciative until they took her to the cemetery in one of these horse driven carriages. And I say, when it's my time to go, maybe I want to have a horse driven carriage like Miss Munger, who probably was as shocked as she could be because she was just plain as plain could be. I'm saying she was plainer than plain. She didn't worry about buying stuff. She didn't worry about being seen. She didn't worry about none of that. And her family had her driven to the cemetery in a horse driven carriage. And so you never know the impact that all of you have on the lives of people whose lives you've saved, people that you've gotten on the right track, people who've made use of the expertise that you've got and all that you really mean and have meant. So I say thank you for being the savers and the purveyors of a better tomorrow. And that's mine till next week. So thank you very much, Nikki, and everybody have a good one.
That's right. So remember to join us right here next Monday night, same bat time, same bat station, right here for Couch Conversations with the Doctors, where true health is wealth. Remember to always make sure you wear your face covering the proper way, as you see Congressman Davis with his face covering on over your nose and mouth, as he is wearing that so correctly to show you guys to make sure you have it on correctly. Thank you so much, Doug, just as well over your nose and mouth, even if you've had the vaccine. All right, Dr. Mason and Dr. Hampton, keep those face masks right across your nose and mouth. Remember to wash your hands. Wash them very good for at least 20 seconds. Make sure you have your hand sanitizer on both sides when you're washing. And then also remember to wash your hands before you touch anything that is contaminated.
Pete, I think you may have.
We are so close. It's coming. Thank you guys so very much. Thank you guys so very much, and we'll see you next Monday. Next
All
Monday.
right.
Thank you. Thank you, Congressman.
All right. See you all.
So yeah.